We know for sure that, patients, athletes who have had an ACL injury in the past are at a higher risk to either re-tear the graft, meaning re-tear the knee that they had the ACL surgery on, or as it turns out, tear the other knee ACL. It's basically one of the major ligaments inside the knee, and it helps to stabilize certain motions of the knee. And it's important, it turns out, for sports. So a lot of sports, especially like soccer, football, basketball, where you're changing directions, jumping, landing, sometimes landing awkwardly, like that's when the ACL is kind of the most important controlling entity in the knee. For the vast majority of competitive athletes and even recreational athletes who want to maintain their activity level, we usually recommend that they undergo an operation. And so that operation is called an ACL reconstruction. For elite athletes, and I think this is probably, like you said, is attributed, and we kind of don't know scientifically why this is, but probably because they're so elite, if you will, that they oftentimes will successfully get back to their sport. I think what happened in Jordan's situation is he had torn his ACL in the past on the one side, had successful surgery, returned to the pitch, was playing again at a high level, obviously was playing for the Sounders, and then was playing in Europe. And then I think tore the ACL on his other knee, kind of the contralateral ACL tear. So like I said, that happens, unfortunately, in the situation where you've had an ACL surgery and you re-injured that knee. There is definitely concern and more cause for potentially, higher alarm, I guess, if you will, because there is a risk that you may not be able to get back to the level that you used to participate in sports. And then there can be other injuries that are associated with the ACL tear. Unfortunately, it's common that when you tear your ACL, you tear other important structures in your knee, specifically the meniscus tissue. And we all have both a medial and a lateral meniscus, so two menisci, one on the inside, one on the outside. And those are also incredibly important for not only stability, but what we believe they also do is serve as shock absorbers in the knee. And so if you tear that as well, which the risk of, tearing the meniscus goes up the more times that you have ACL injuries, that makes it harder to recover from. In terms of the prevention piece, there are definitely some studies that have shown that there are certain what we call neuromuscular adaptations that can come from training your body a certain way. And that for sure can lower the risk of ACL tears. It has to do with strengthening the legs, strengthening the quads, keeping your hamstrings strong. There are some exercises that they have you do as part of the warm up where you're kind of jumping on one leg and jumping to the other leg, because we know it has to do with balance and core strength and things like that. And we really don't have an answer for why that is and why that happens to some athletes and why it doesn't happen to others. It's really interesting. There's still a lot of information we don't have about ACL tears. So a lot of research, a lot of interest on our end to try to figure out if we can, really try to prevent these things.